Welcome. One issue that care partners often struggle with is what to do when the person with dementia is no longer interested or engaged in activities and will no longer attend social gatherings. One care partner recently wrote in about her normally active and engaged husband. She was concerned about him because he just, as she said, sits and stares. She doesn't know how to engage him or include him. Sometimes this is mistaken as depression, but it's actually a very common symptom of dementia called apathy. Apathy is one of the most common symptoms of dementia, and it changes as the disease progresses. The brain cells that are involved in apathy are related to motivation, or the get up and go part of the brain. Perhaps you've heard it called the starter motor. This can make it really difficult for people with dementia to actually begin activities or to maintain the energy to carry through with activities once they start. Caregivers very often worry that they aren't doing enough, that they're not providing enough activities, or they don't know what activities to provide them. They are worried that if they're not engaged, they're losing more and more of their capability. It's difficult to watch someone that you love lose these abilities. Sometimes we hear this referred to as, I'm losing the person I once knew. We want to reassure you that when someone is exhibiting symptoms of apathy, they're not bored, they're likely not depressed, and they're not even really suffering. It's often much more difficult on the caregiver than it is on the person with dementia. And there are things we can do for it. So let's talk about some strategies that might be able to help you deal with apathy. In the early stages of the disease, it may be something as simple as laying out activities for the person with dementia. A word search and a pen, or the napkins and plates for setting the table, and showing them where you've put them. Later on, you may actually have to actively engage in getting them started by putting the pen in their hand or the napkins in their hand and walking around the table with them to lay them down. As the disease progresses and apathy increases, they may not be able to engage in those activities at all. However, they can still enjoy passive engagement by attending social events, even if they may be sitting alone, or listening to you read aloud to them, listening to the radio together. These kinds of activities give you an opportunity to still share something together that may bring them enjoyment and gives you an opportunity to feel that you're still engaged, even if it's not the same as it used to be. In summary, apathy is a very common symptom of dementia. It relates to motivation and engagement. It's often more difficult on family members and care partners than it is on the person with dementia themselves. They are not suffering. Interventions for apathy change as the disease progresses. In the beginning, it may simply mean laying out an activity and pointing their attention to it. Later on, engaging actively and keeping them actively engaged throughout the activity, to no longer expecting them to participate actively, but still allowing them to be there with you. For more information on apathy, visit your family doctor, your local Alzheimer's Society, the Reitman Center at Sinai Health System, our Enhancing Care Program website, or download the Dementia Advisor app.